Hi, everybody. Happy Sunday, May 2nd. And if you caught my short, I'm really excited. Really big lineup this month. And welcome to Bend and Stretch with Sue. And this is the first live that I'm actually hosting as far as having a guest, other than the partner yoga that you might have seen already over the last few months, the Thai massage that I did live. But today it's all about chatting. And I'm going to first tell you just a little tidbit and give you the lineup for the month. And then I'm going to bring on Yolanda and let her explain to you what her expertise is and how this relates to your fitness journey. So I want to take a pause here. I see that we've got Be Better Motivation is here waiting to join us for this live broadcast. So thank you so much for being here. And I do encourage you to fire your questions in the comments. And from time to time, we'll be pausing and giving Yolanda an opportunity to answer the questions for you. I see Anton Reckner is here too. Welcome, Anton. Happy to have you here. So for the month of May, I'm producing content every single day. And we kicked it off yesterday with a short, just to tell you a little bit about the lineup for the month and for this week ahead. This week, I'll be offering you 3 yoga practices live. I've got 2 of them in the mornings. I've got Monday morning at 11 a.m. as well as Friday morning. And then on Wednesday, for those of you who are maybe in a different time zone, we'll be doing a 4:30 live. So I'm hoping that you'll take in some extra yoga. I've got some videos on Tuesday and Thursday, and then we start it all over again next Saturday with a short, giving you a little tidbit on what's going on. But as far as Sundays, we'll be hosting a speaker. We've got Tina Ferrone next week, who is a actual yoga studio owner. She owns a premium studio in the capital city, Ottawa, Canada, and she'll be telling us the ins and outs of having a bricks and mortar yoga studio as well as a virtual yoga studio. And on the following Sunday, we'll be hosting Stephen Beardbrier, who is a real founder of the fitness movement within our local area as well as the global community as well, and really giving you some inspiration, some tips on not only your own personal fitness, but how you can help your community become more fitness aware and just really motivating people to a healthier lifestyle. Following that, we'll be having Move with Jen, who, if you're catching this now or on the replay, you'll know that Move with Jen is absolutely loved by everyone in the fitness community here on YouTube. So we'll be talking about life as a yogi on YouTube, and then we'll finish up the month with Miriam, who is a good friend of mine, and she'll be telling us what the lifelong journey of a yogi and a fitness enthusiast is all about. So be sure to stay tuned for all of that, with lots of Pilates and yoga in between. So now today we're talking about the pelvic floor. So it may seem like a little bit of a hot, spicy topic. And of course, in my training as a yoga teacher, as well as a Pilates instructor, there's a lot of talk about the powerhouse, and that involves the pelvic floor, and as well as the Mula Bandha for all of you yoga people. So we're going to dive deeper into that, and how does that really translate into giving you more power from the powerhouse, more strength and focus from the Mula Bandha when you're moving through your yoga practice. So let's find out more about that. Before I turn it over to Yolanda, I just wanted to welcome Nona Grace. Thank you so much, and I'm really happy that you're here as well. So let's have Yolanda tell us about her expertise, her credentials, how she came to be this type of specialist, and also, so we don't forget, she's also a yoga teacher, and Pilates instructor. So Yolanda, tell us all about this spicy topic.
Well, first of all, Sue, thank you so much for having me on your channel. And this is Vaginia, everybody. She's my vulvar sidekick in my videos. So I'm really excited to be here and share with you all this amazing information. So as Sue mentioned, I am a pelvic floor physiotherapist. So basically, a pelvic floor physiotherapist focuses in the lady part area, men part area, but also really it's like a holistic approach to treatment. But we deal with a lot of fun lady part issues. And I'm also, my first love was my fitness. So my yoga and my Pilates. And I also actually am now a TRX instructor. But what's great about it all is that I can understand the body now and incorporate all that in terms of a functional way, and especially in my own practice and everybody else's functional integration, because it's so important to be able to become aware of this area, but also how do you actually put it into practice? If you know how to contract this muscle, it is important to do that. But if you can't integrate it functionally, like when you're standing, doing any of your yoga moves, or even functional things like lifting, then it's really not it's not being functional. So you got to be able to integrate it functionally. So with respect to what Sue was saying, with respect to the powerhouse, these muscles in the lady part area are really important with respect to the powerhouse, because they're part of the core, which I know a lot of you ladies out there or men that are joining us, if you're familiar with what Sue does, it's a big part of your body is being able to stabilize. Now, I'm just going to grab my pelvis to show you in terms of where the muscles is, so you have a bit of an understanding. Just a sec.
Now, while Yolanda is doing that, I want to take a moment to let you all know that in the description, once this goes on the replay, and I'm sure you can see it now as well, all of the links for Yolanda's information where you can contact her are available there. But Yolanda has a YouTube channel. She's fairly new to YouTube, so I really hope that you will go show her some love over on her channel called Yo and Vaginia, and she's got some amazing videos. She hasn't been on very long, but yet she's produced some really educational content that I'm sure you'll enjoy and just learn more and more, because it's all part of your fitness journey, is learning about this. And you want to know how to, wellness and health is not only exercise, it's the whole picture. It's your nutrition, and it's what's going on the inside as well as on the outside. Sometimes we're motivated by starting our journey on the outside, but it's important to know what goes on behind the scenes. So back over to you, Yolanda.
Thanks a lot for that introduction, Sue. And just actually adding on to what you said about the holistic part, definitely with pelvic floor. I mean, there's so much of a social stigma in terms of, this area here, the lady part area, and it does attribute to your overall mental health, right? And sexual health. And that's all you. It's not just physical. I mean, as all of you know, it's soulful. I mean, this all integrates. So if there's something going on in this area, and not just something physical, but also something emotional stuck here, as you know, with all the yoga, the chakras and everything like that, and just not even being comfortable with the area, that affects your whole outlook of who you are. So anyway, I just wanted to add on to what Sue said, that I totally agree. So these are, if you can see this, the pelvic floor muscles. So you'll actually learn about that a lot more in detail in my videos, but that is a big part when I'm talking about the core with the powerhouse. So I know they talk about Mula Bandhai and Udaya Bandhai, but this is what you're actually trying to recruit also, because that is a part of the core. And then you've got, of course, your muscles with respect to Pilates. You've got your transversus abdominis and all the other stability muscles. So it's a big part, basically, of your core. And that's why becoming aware of that is important. And the thing that I wanted to get through too, it's not about just strengthening this area. A lot of times it's about balance. Of course, we want to balance our whole bodies. And that's, of course, your strength, your flexibility, right? Your agility, things being in a normal sort of, it's called a length and tension. So sometimes people think it's all about strengthening. And that's why I actually like the blend of yoga and Pilates. I'm sure, Sue, you would probably attest to that. I just love the fact that you've got some stability aspects of Pilates, but then you've got your relaxation and your stretching and flexibility with yoga. That's so important with your overall health. And with respect to the pelvic floor muscles here, it's not always about doing Kegels. So if you've never heard the word Kegels, that basically is a word that is the name of the exercise where you're working the pelvic floor muscles. It was a guy who invented it. His name was Kegel. I think it was Dr. Kegel. So, but with respect to these muscles here, it's also about making sure that it's not tight. So sometimes actually, as a Pilates instructor, someone who actually is tight in this area, too tight, you actually don't want them to keep strengthening them. So Pilates can be tricky with someone who has a tight pelvic floor. And the only way you really know, honestly, is if someone actually assessed you. And also some symptoms might be that you have some pain down in this area. Pain during intercourse is a big one, which is normal for women. And often that could be because these muscles are tight. And then there's other conditions that can cause it. But just know it's all about balancing in this area. It's not just about strengthening, but about relaxing, lengthening your whole body, right?
I so agree with that, Yolanda, because as you say, it's all about that balance. And I think that's one of the areas where the breath is so important in really able to get that relaxation through the body so that you do have, you're able to contract the muscles, but you're also able to relax the muscles. Because from what I've heard of so many is that you can have injury resulting from having those muscles on overdrive. So it doesn't matter whether it's your heart muscle, your pelvic floor muscles, any of your hip flexors, if they're on overdrive all the time, you're no further ahead. It's detrimental to the big picture of your health.
Yeah. So a good point about with what you mentioned with breathing. Of course, right now it's such a stressful time, right, with the pandemic and life in general. So breathing, and I haven't actually launched that video yet, but there's a huge connection with breathing and these muscles here. Because when you breathe normally, you actually get the pelvic floor working on a natural way, like you inhale and it stretches and you exhale. So making sure that you're flexible through your rib cage, which is all about stretching and yoga, will maximize and optimize your breath, which works these muscles naturally day to day, which is what you want. You want to be able to have these muscles contract and work functionally, and making sure you optimize your breath. So if you're tight in your upper back or you're stressed, right, you keep things in, you're not getting that optimal breathing pattern. That's so important. And again, it helps to relax everything, right? Relax your muscles. And like Sue said, if you're tight and you're stressed, well, we all know the body is connected, right? So you can have some tightness up here in your upper back, but that's going to pull down and into your pelvic floor. You keep things tight, your intestines, all your organs, it's all connected, right? And as we get older, which I know, I'm sure all of you guys could attest to, I don't know how old many of you are who are actually with us today, but things start catching up. So if there's something pulling in one area, it's going to throw you off. It's all connected, right?
Yeah. Absolutely. Yeah, for sure. And I think that's perhaps one of the areas that so many of us fail to recognize is that it's all connected, and the importance of achieving balance. So say if someone was to come into your clinic to see you, and you recognize that there is that lack of balance. Perhaps it's accumulated stress, or maybe it's the cumulative effect of the years that's causing, I would imagine, what sort of symptoms? Perhaps hip pain, lower back pain. You said pain in the pelvic floor area as well. What other sort of symptoms would you see?
So a lot of times, a lot of that is disclosed from their subjective history, right? I always ask about, like, especially more pain symptoms, I would say, because that's basically a tight pelvic floor can cause a lot of pain. There are other conditions, which I won't go into in this live, but you can actually refer to on my YouTube channel. But so if these muscles are tight, something could be grabbing it. So usually I often do a subjective assessment, where I ask them actually, especially people who are all of a sudden, they say, oh yeah, I started having pain during intercourse, and even incontinence. So sometimes incontinence is not just from a weak pelvic floor. It can be from a tight pelvic floor, because if those muscles are too tight, they're not going to work to close the opening of the bladder or even anally. So often people think, oh, I've got a weak pelvic floor, let's do Kegels. But again, it's not all about Kegels. So often I'll sort of, I want to actually find out, okay, what's going on in their life? And often I'll find that, yeah, there's been a big stress. They don't necessarily have, new upper tension or back pain, but they definitely could. Or or maybe they have a hip injury, right? Or something. And that often translates, or even actually one of the big things I find is digestive issues. Because you think about this whole cavity here, where your abdominals and your intestines here. Well, I describe it like a balloon. So and I have my balloon here. So if there's pressure, right, pushing down, let's say you've got even just you're bloated, like you decided to take up on a lot of dairy and you're becoming intolerant. It's amazing the connection here to the pelvic floor. As I've been working now in this area for 15 years, and the more I know and the better I get, the more there is in terms of what affects the pelvic floor that is just not in this area alone. So stress, it can affect your intestines, right? I know when I do my YouTube channels, I'm going to the bathroom all the time because my intestines are working hard. And like, right? So what people tend to do is they tend to hold things in their, and then like I said, their rib cage, and they get tight and definitely upper back tension, that kind of thing. And eventually that can put stressor on there, potentially, right? So yeah. So the holistic sort of finding out what that person's going through, what's happened, even like, whether it's stress, surgery, like something they've eaten, anything going on, they may not realize that it's connected to that area. Yeah.
For sure. So as far as the fitness journey, certainly exercise and, perhaps as a prescription, maybe, people are very concerned with muscle tone and strengthening. And, we've talked a little bit about the breath, but what would you advise someone to maybe look at having more of the stretching, the breathing component, maybe even including yoga in the regimen? You may have somebody, for example, like a weightlifter who, all these questions are coming to mind as I'm moving toward this one question. But first, what would you say as a prescription to someone as far as obtaining more balance in their regimen?
Yeah, so I definitely, with people, the clients that I see, I will recommend breathing exercises. That's a big thing. Even nothing fancy, not that I'm saying that the yogic breath isn't fancy or anything, but even just to breathe. Because if you're stressed, you hold your breath. So that's part of, I think it should be part of everybody's regime, whether it's a meditation or they just take time to do a deep breath, hold it and release, because that'll stimulate relaxation in the area. It'll massage through the abdominal area, take that stress out, open up the rib cage. There's so many benefits. De-stress, keep your mind off things for like whatever that is, that minute. So that's part of the regime that I get my clients, mostly almost all of my clients do, whether they're seeing me for incontinence or pain, or for example, anybody who doesn't have anything. I think that's so important in your life. Stretching for sure. So yoga is fantastic because you're getting that full body integration, stretching everything around. Any of the big hip muscles, right, are going to affect the pelvic floor if they're tight. Your hip flexors, you've got your deep hip muscles in here, your piriformis. I love the hip openers. Those are fantastic for basically relieving stress in that area and tightness, because you can see there's a muscle right here and that sits right on top of the pelvic floor. So that's called the obturator. So if that's tight and you have hip pain or it's tight, right, that can definitely pull on that muscle. Things, as we know, right, again, the whole balance thing. So definitely a full body flexibility stretching regime. And then, integrating your core, whether you're a weightlifter or someone who's at a desk. And I see more pain, like people with back pain, sadly. And I'm the same right now because I'm on YouTube so much, I'm on the computer. My neck, my upper back is sore, right? Making sure you're strengthening your core, having good postural stability, more functional stability. And of course, that's focused and geared towards what you do. Obviously, if you're a weightlifter, you've got to have more stability to be able to weightlift. So it has to be specific to what you do. So whether you're sedentary or whether you're an athlete, definitely, I would say all those three regimes are really, really important. The relaxation, right? The flexibility, stretching, and the core. Yeah.
Now, would you say, that as a practice, when someone is involved in something as powerful as weightlifting, even other exercises, but we'll look at weightlifting first. Would you say that most of them intuitively engage the pelvic floor, or do they kind of not even take that into account as far as utilizing, everything they've got?
Yeah. It's hard to know because so there's a thing called synergy. So the pelvic floor muscles are supposed to work synergistically, like together with that core. So when anybody is engaging the transverse abdominis, which most of you know is that core, that deep core muscle, like a corset, it's supposed to pull this at the same time, theoretically.
Right.
If you have a weakness or a dysfunction, that might not work. So I actually always wonder about that, because even when I learned Pilates, we didn't focus on the pelvic floor that much, right? We didn't say, okay, engage the pelvic floor, and then like where I was taught. So I make sure I tell people that, because theoretically you do want, in terms of stages, you want someone to pull the pelvic floor first and then pull the transverses, because you want the pressure to go up this way. So it's minimizing pressure pushing down, which is important with women who have prolapse and things like that, which is when the pelvic organs descend down lower. And just in general, because that's when I see the CrossFitters. My kids are really into CrossFit right now. And I look at what they're doing. It's so heavy. And I'm not a CrossFitter, so I can't say exactly, but I see some of the exercises, and you have to be really strong. And I know, because I've treated some CrossFitters, and a lot of them tell me that a lot of them do have some leaking issues. And I'm not sure. Sometimes, again, the leaking issues can be from someone who's tight, but are they integrating this muscle effectively?
Mm-hmm.
Doing? And, I think working it consciously first is important. And then your body should subconsciously, contract these muscles when you're weightlifting or lifting something without having to think about it.
Right.
Yeah.
Yeah.
So it's hard to know, honestly, if they do it or not, right?
Right. Yeah. When I did, and the reason I ask is because when I did my Pilates training, there was quite a bit of focus on the pelvic floor engagement, which I guess was a really good thing. That was one of the points that came up, is that in working with weightlifters, that the ones who did not know prior to being taught that, there was a significant difference in the amount of weight that they could lift once they became more conscious of the role that the pelvic floor plays. And this leads me to, traditionally weightlifting and lifting heavy is a gentleman's arena, or has been in the past. That's changing. How would you cue gentlemen, or would you cue them any differently than you do with ladies? I usually use the drinking a few cups of coffee and maybe traveling on the road with the rest stop being far away, as far as the muscles that need to get engaged. The way I was taught was it's about 30 to 50% engagement as well. You're not squeezing with all your might when you're engaging those muscles. So if you can elaborate on that and maybe clarify a little bit.
Mm-hmm. So when you are integrating this functionally with, let's say, I'll just throw it out there because everybody knows planks, for example, or if you're going to do a deadlift, or it's not like you're contracting, Sue's right, as hard as you can. You're just recruiting. So if you're talking percentages, maybe 20, 30%, just engage it, which is like an in and lift, and then pull in your core. So that's what I would say. With men, I use different reference points, of course, because their anatomy is different, but it's like pulling in their scrotum or their testicles up a little bit more towards their body, and pulling in their penis. Actually, I use different sort of frames, obviously, anatomy points for that. For women, it's like an in and lift, and you can still get that with men. You can say in and lift, like your scrotum or your penis up towards the front of your pelvis. So it's a squeeze and a lift. Engage that a little bit and then keep going. So I usually say pull up from the groin up is what is usually my cues, instead of getting too complicated. Yeah.
Excellent. So just a little pause here. Just wanted to acknowledge some of our viewers. We've got Be Better Motivation. We have Jason Bailey, who's popped by, a fellow Canadian as well. And we've got Kathy D, who's here, always a strong supporter of the channel. So welcome everybody. And Nona Grace is here too. So if any of you have some questions, by all means, pop them into the comment section and I'll be sure to relay them to Yo so that she can answer your specific questions. And a little bit of a shout out as well. Some people that I just wanted to take a moment to recognize, whether maybe you come in a little later or see this on the replay, some of the people that are really strong supporters of this channel, and I invite them all to go and visit Yo and Vaginia over on her channel, are Daniela Joy, Peaches Skincare, Majors, there's Vaginia, and Ogie Silver Fitness. We've got Heaven Glamour, Move with Jen, who's a real pro at doing these lives and interviews, Prepping with Sarge, with Shea Butter, Adrian and Nico, the Tattooed Ronin, as well as FitStem. So, and if any of you who are already tuned in here, by all means, you can go ahead and use the comment section to maybe plug your channel a little bit, what you do, and I invite everybody else to go and visit their channel. So go ahead, and you've got my blessing to go ahead and do that. But in the meantime, we keep going here. I'm glad it looks like everybody's enjoying the information. Nona Grace says that she's enjoying it. So does Jason, says that the information is really interesting. So yeah, and it looks like Kathy is all keen as well. So now we talked about weightlifting just before this little interlude, but I wonder about some of the other sports or other activities, like maybe running. You mentioned a little bit already about leakage, certainly as you know, maybe women who have had children start to, you know, they have to limit maybe their jumping jacks, or even when they're running, they find that there's a, you know, some issues there around some leakage if they don't have that proper balance. Can you talk to us a little bit about that as well? It might be a concern that several of the ladies have.
So with respect to postpartum, I see a lot of women that have issues. Probably more prevalent lately is prolapse, and that's when something hangs down. I'll just show you my little thing here. So I have this little balloon, and a prolapse is when things hang down in the pelvis lower than it should be, so your pelvic organ. So what you would see is, I don't know if you can see this, but something hanging out. This is like a little balloon pushing out, but it's not quite. So you can have your uterus, unfortunately, your bladder, the opening of your bladder, your rectum hang out. And I see the thing I find with postpartum women is they're getting back into doing activities quicker than they really should be. I find, you know, that's our culture. You know, we've had a baby, and you think I mean, it's really traumatic what happens down in the pelvic floor. And I find, you know, of course, it's being stressed, it's loose. Their pelvic organs might be descended too, and they don't realize it. And then they're going running too soon before things have a chance to heal, especially like before the 6-week mark. I even do find, because I myself personally, if I look back, I think I should have waited to run also. Because, I mean, like I said, the trauma that happens to this, and if your pelvic floor basically isn't meeting the pressures of you pushing down and running, right, he needs time to catch up. And that's what I tell my clients is be kind to the pelvic floor and give it time to heal and catch up, right? So it can withstand some of the pressures pushing down. I see that a lot with a lot of women, and, you know, they're leaking and they're still going running, and they've had a tear, right? And even if you haven't had a tear, there is trauma there. I mean, birth is an amazing thing, as we all know, right, with women who've had kids, but it is traumatic to your body. Now, when you're talking, okay, so that's postpartum, which I see. With respect to running too, there is definitely pressure pushing down the pelvic floor. So if you're running and you're having leaking, I do think it's really important to see a pelvic floor physio, because it could be that you have the tightness. It also could be that you're not quite engaging the pelvic floor. And also it could be posture related too. So depending how you're running, and I'm not a runner, I would say I jog more. But if you, depending on how you're running, if you're running up too much straight and your posture, that can definitely affect where these muscles actually are lying and where they may not be working optimally. So postural alignment is important. You don't want to run straight up. You want to think of running posturally with your ribs over your hips. So things basically, again, how everything is related in terms of the activities that you do with women. Right. Yeah. So just know that with women, like, I mean, I hear all the time, okay, I can't jump on the trampoline anymore. I can't do jumping jacks. And that is an indication of something not quite right that's there. And usually those group of clients that I see, they actually are my easy group, that they only have something that I need to tweak, whether it's, okay, you're not quite aware of that muscle, you're not doing the in and lift, there might be a bit of tightness we need to release, or your posture. So that is easy to address usually, and not always.
How long would that take? How many weeks? Or,
yeah, I give an average of, I would say 4 to 6 treatments. Yeah, about. It really depends. It's hard to say exactly. So, because they could have something going on, but even just one, if you're seeing a pelvic floor physio, even just one assessment is helpful, because they can do things and say, hey, just try it this way, go home and try to do this Kegel this way. And maybe it's just how you're doing it. But then if you have tightness in these muscles have to be released. Just like I explain it to people, like if you have a tight calf, right? Well, you're not going to do calf raises, right? You're going to stretch out the calf, massage it out. And so that muscle, the tone or the length is normal before it can contract again, because a tight muscle is like this, and this is the pelvic floor. So it needs to do this. It needs to contract and relax all the way. And if it's stuck for some reason, where there's scar tissue like this, then it's kind of doing that and it's not being effective. So I would say with stress general incontinence, at least for me, I'd say 4 treatments. But again, it depends on your body awareness.
Yeah.
And how, what's going on. So everybody is very individual. Yeah.
Right. Yeah. I just want to take a moment here to welcome Debbie and Charles. Hello to you as well, and welcome. We've had a really good discussion so far with Yo and Vaginia. And so far we've addressed some of the exercise component. We've looked at the anatomy of the pelvic floor muscles, and you may want to catch that on the replay because it's quite interesting to get a better understanding of, in your fitness journey and when you're exercising, what muscles are at play and the importance of the pelvic floor. In yoga, we call it the root lock, we call it the mula bandha, in Pilates, we call it the powerhouse, and it really is that. It's a real source of stability in the body, which when you've got that perfect balance of strength as well as the ability to relax the muscles, you can achieve that yin and yang that is so important in every aspect of life. And I do have, so be sure, all of you, if you have some questions, send them our way. You will be very happy to ask them for you, or to answer them for you. And I do have one here from Kathy D, and she's wondering what are some of the daily tricks for both men and women that they could do to improve their muscles in the pelvic floor area, especially as they age.
Right. Okay. So I find even though these muscles you think are easy in terms of incorporating them, because you don't need a mat, like in terms of contracting them, you don't need to sort of integrating it functionally is important. But I get clients, because they don't seem to do their exercises regularly. When I start with a client, I actually want them to be able to isolate these muscles on their own to bring that awareness. So they have to be able to connect, that connection between your brain, muscle and the nerve, right, of where these muscles are and how to connect them, right? So I try to get them to incorporate it functionally. So let's say in the morning when they're brushing their teeth, or, now unfortunately we're waiting in line with COVID. So you're standing there, what am I going to do? Everybody's on their phone. Oh, well, why don't you do a Kegel, right? You can, and there's different Kegels, and those you can find my videos too, where you can just hold and you don't think about it. And then the other thing is incorporating it functionally, which is just as important. So I get my clients to, when they're doing the dishes, because I've got a lot of moms and stuff that of course are busy, can't do it. So even any of those balance practices that you do, like it doesn't have to necessarily be a tree, or any of those postures that we love, but even just standing on one foot and you're doing the dishes or cutting stuff, right? You can incorporate your pelvic floor, because whenever you're engaging proper posture, your pelvic floor should be working with all the other muscles. And then of course you've got your other stability muscles, like your hip muscles, like your gluteus medius. They all work together with keeping you in balance, and it's more functional. So I get clients to integrate it that way. So it's a lot easier. So they don't feel like, oh my God, I got to do my Kegel exercises, and it's a little bit more fun. And then of course, if you're doing your planks or anything that you're doing in your yoga class, like any of the postures, you're standing, your mountain, your warrior, I mean, think about your postural alignment, and then it should all integrate together. So you are working it just as much as doing Kegels. And when my clients, after they know how to isolate these muscles, I always tell them, like, if you're integrating it functionally, you're doing it even more now than you realize, and you don't have to think about it. So that, so it doesn't seem like an exercise, and it's just brought in naturally, if that makes sense.
Yeah, that's awesome. And if anybody is tuning in right now, I just wanted to mention again that Yo here, it has her own YouTube channel, Yo and Vaginia. So all her information, her Instagram, her Twitter, will all be down below in the description. So I invite you to check that out. But her area of expertise, if you've missed it, is she's a physiotherapist, and her specialty is working with the pelvic floor muscles. And so far we've covered quite a bit of information as to what can go wrong with the pelvic floor and how to fix it as well. So yeah, it comes down to balance in all areas of life, as well as gaining a better understanding of what's going on in your body, not so much only a focus of what's going on in the exterior, but what's going on holistically. Really, this gives everyone a really good understanding, Yolanda, as you're explaining this. So we really appreciate bringing along your props and making it so that it's not, Kathy D mentioned that the muscles can be somewhat tricky to identify and to get familiar, because I can attest to this. When I am teaching Pilates, one of the things that I find that I have to caution against is people clenching versus engaging. So how would you say is the best manner for people to really kind of, really click in and really internalize if they've got the right muscles?
Okay, so here's a tip that I get my clients to do. So it is the same muscles that, of course, stop you from leaking. And, if your bladder's really full and you're holding it, right? So it's the muscles that you engage to stop that from leaking, and also for number two. So when you go to the bathroom, right, what you could do is, as soon as your flow starts, try to stop the flow of urine, and just feel what you're doing in terms of what muscles are kicking on. And that would be the pelvic floor muscles. Usually it gives me an indication if I ask them, okay, can you stop your flow of urine when you're really, really full? And they'll say, no, I can just slow it down. Then that gives me an idea that, okay, that there's some dysfunction and it's not working as well. However, just on a note of that, you should not do that on a regular basis, though, just as a test, maybe once a week, because normally that's not how our bladder works. And if you keep fighting it and it wants to release, it can cause some other issues. The other thing that I give with clients in terms of what you mentioned, Sue, about clenching, right? Just so you're engaging before like a Pilates move and not just really squeezing. And also to determine if you're tight or not is I get clients to do a squeeze, and then release, and focus on the difference between the sensation you feel, the awareness of when you're tightening this muscle and relaxing. And do you feel a difference? What is that difference? And that's the muscle working. I find that's really important with my clients who are tight. And if they don't know that they're holding the muscle. So I get them to really squeeze, because it gives you that awareness of having to relax the muscle, and then they let go. And then you know how much, if that muscle is contracted, and how to relax it, if that makes sense. So, because if you don't know how to contract that, right, you won't know how to relax it.
Yeah.
So, yeah. So it's hard to, the other thing is, I'm just thinking in a class, obviously, because I have access internally to these clients. The other thing is, if they put their hand on the perineum, which is basically the area between your, I don't have the outside. Oh yeah, I do here. So this is the perineum, the area between the vagina, and obviously with men, it's this area like where the anus is, kind of thing. If you put your hand there, in that area, and you do a Kegel, and you try to do that in and lift, that can, and you should feel it pull away from your hand too. So you're lifting away from your hand. So that can give you a little bit of an like indication when your hand is externally, if anything is happening. So often I'll look at a client before I actually do things internally, and I'll see if there's any movement there. The other thing is sitting too. A lot of people find, my clients, that they'll actually find doing a Kegel is easier sitting, because I think they have a frame of reference where they can think of pulling away from the chair, right? Where they're away from the chair and they feel that release. So anything that improves that cueing or proprioceptive awareness can often help.
Yeah, I like that tactile.
Yeah, sometimes I get people to put a rolled up towel in their perineum, or even put their hand there when they're sitting. And then again, cueing, okay, pull away from the towel and relax. So getting them to feel something, because if someone's really weak, they really don't feel anything. It is hard to work with them. Anything that you can sort of connect with, they go, oh yeah, I feel something. But I mean, your population, Sue, is probably active. And I love working with active people, because they have a very good awareness of usually of their body, right? So they would pick it up faster. Yeah. Right.
Yeah. No, that's great. I really, really like that tactile tip. It's a really good way for people to, if they can feel the difference just by using their hand, let's say, it just helps that mind-body connection to strengthen.
Exactly.
So important. That's a muscle in itself. So, so I think, I hope, Kathy, that answers your questions. I think that was really good job, Yo. And Nona Grace, I believe that was right up the alley of the question that you were asking. And because she asks, or says that, or asks if it's wise to stop the stream of urine when she was younger. That's what was suggested to strengthen the pelvic muscle. So I like the differentiator that you said, Yolanda, where it's not something you want to do regularly. Great way to get a good benchmark as to what's going on with the muscles to strengthen the engagement, but not, you don't want to do that regularly because of the impact that it's going to have on the bladder itself, so that you don't want to develop problems there. So we're enjoying the information here. Somebody is automatically doing it now while listening to the information. Excellent, Debbie and Charles.
Yeah, it's easy. That's the thing. It's probably the easiest thing to do. You could sit there and you should be able to breathe and talk at the same time. And, and it is easy. You're right. Like when someone goes, oh, you should do your Kegels, and then they're doing their Kegels.
Yeah. And that's what I find with the, with the pelvic floor engagement, or even the Mula Bandha, is when cueing that, is that they should be able to talk and breathe. You don't have to hold your breath while you're doing this. So please don't hold your breath.
And that's the thing is, the connection with breath. In the beginning, people will engage the pelvic floor and they go, right. And so you're not doing it with the inhale anywhere. You're doing it with the exhale, and it's just not natural for them. And then later they realize, okay, it's natural.
Yeah.
I just noticed that someone was asking about, in terms of people awareness of the pelvic floor. Definitely I find it's better now in terms of people knowing about the pelvic floor. It's still, the awareness is still poor in general, I find, because I work with a lot of specialists too. And I find they're not, some of them are great, and with anything, right? They're great physios, there's great doctors and stuff. But still, there's a lot of health professionals that don't know about this area, and there's pelvic floor physio. I see a lot of people who are like, well, why doesn't anybody ever tell us about these things postpartum, or, you know, that this can happen, or we should be doing this and everything. And it's true. And I think us as like just laymen and the public, I think we have more an effect, to be honest, on actually educating our healthcare professionals by actually saying, hey, you know, did you know there's pelvic floor physio? Because there are some GPs that still don't know about this. And the specialists, there's so many women who go through the women's health clinic here where we are in Ottawa. And you would think that, I mean, we would be inundated. I mean, a lot of us are very busy, we have waiting lists, but there's not that many of us. And it's just that people are not getting referred because the doctors maybe don't believe in pelvic floor or don't realize what we do, but definitely better awareness for sure with respect to this area. And I think mothers are getting on board in terms of learning about this area and being proactive, but still there's a long way to go. Just on the note of awareness, in France and parts of Europe, every woman who has a baby, part of their social health system is they see a pelvic floor physio and an osteopath. So they're right up there in terms of preventative care, which is what I'm really advocating for, is that awareness. So, you know, yeah, it's like, well, you see a physio after you have knee surgery or hip surgery. Well, why wouldn't you after you have a baby, right? We're just expected to sort of, our body's just going to go back in place, which I'm amazed how our bodies do a lot, you know, actually everything moves and goes back in place. But what about these muscles, right? And of course, I am a mom. At birth, you're concerned about more, okay, am I healing? How come my baby's crying? How come my breasts are, you know, all these kind of things. And they don't actually take care of themselves. So in France, that's what they do. It's like you see a physio and you have 6 treatments with them, and that's part of their healthcare system. And
wow, that's interesting. You know, prior to meeting you a few years back, I didn't realize that, you know, there was such a specialty as pelvic floor physiotherapist. Now, since then, I've met a few of you. So perhaps it's becoming a little bit more well-known in an area that certainly is growing, and there's so much need. I mean, there's, 51% of population is women, or maybe a little higher than that. So I'd say, you know, that is women who are having babies. Yeah, it's just wonderful that France would have such a program to help women with this such an important area, especially for people that have multiple children. And if they're, with all the trauma that occurs in that area, to have no awareness of the care that's required seems really awful. Now, one of the questions that I do have is, what about the effect, and this is happens through childbirth, I mean, throughout the course of a woman's lifetime, and I'm sure with men as well, is the hormonal effect on the pelvic floor muscles. And, you know, how the hormonal effect will affect, you know, perhaps incontinence and vaginal dryness, and on, a whole host of issues that can occur, you know, going right from puberty all the way up to menopause and postmenopause.
So thanks for that question, because it does affect the pelvic floor quite a bit. And, you know, I think generally in your whole body, especially more for women. So when women go, even postpartum, it's the level of estrogen. So when a woman actually has a baby, right, their estrogen decreases, and even more so when they're breastfeeding. And what estrogen does is it creates a lot of relaxation in your body. And that attributes to everywhere. So including your pelvic floor. So your pelvic floor would be more relaxed, and the tone. So if you've already had a traumatic birth and you're already going through tearing and everything else, and that can make that muscle harder to engage. You also have some people I find are very, it depends on, and I don't know why, but I see a handful that are very hormonally affected, meaning that they actually have pain. Like it's like you're going through menopause where the muscles actually start to really thin. It becomes very sensitive and dry, like Sue was saying. They might have pain during intercourse. It just feels awful in there. That's only a handful of my clients that I've seen. And then that's really attributed to the breastfeeding part, I find. And then once they stop breastfeeding, things actually start to normalize. So definitely postpartum. With the hormone side, with respect to women who have had kids and they are in the postpartum phase. Once you stop breastfeeding, it does take a couple months though for the hormones to actually normalize in your body. So you may not find the effects right away, like in terms of like your pelvic floor working better, that kind of thing. It takes a little bit of time. With respect to perimenopause and all those other fun decades we're going through, again, same thing. Your muscle starts to thin. It's, atrophy is the word, right? And if you have less muscle bulk in this area here, there's more chance of things prolapsing out because there's less support. So you want it to be bulked up. And so you want to start this early though. So that's why it's so important, that prevention side of things is we're going to all go through that as women, unfortunately, and being able to fix as much as possible what's going on if you have a dysfunction early is better. Right? Even like if you go into surgery, you want to make sure the muscles are as strong as possible. Not that menopause is surgery, but things are going to change. Your collagen is going to decrease, right? Your estrogen, and that'll affect down there, and also your tissue. So getting that muscle as strong as possible and bulked up will prepare it for what's happening through menopause to ensure that things are supported well. And even just the muscle engaging, like your urethra will start to thin and just seems lovely. All the things that start to happen during menopause. Yeah. And of course, pain during sex is definitely one I see because things are drier, thinner, less lubrication, and that can attribute to pain during sex too. And then what happens is if you have a bit of friction that you didn't have before with any kind of engagement or penetration, then you start to guard your pelvic floor, and then that can lead to tightness that wasn't there before. And it could be a perpetuating cycle.
Right.
Right? Wow. So preparing for that is really important. So if you have anything that's chronic, even if it's a little bit of leaking, I really recommend get it looked at. So, you can try to optimize what's going on and prepare yourself for those years to come. And if you're already in menopause and you have problems, just so you know, ladies out there who are of that age, my oldest lady was 89 that I saw. And I treat many older women who respond really well to physio. I actually have some 70-year-olds who are responding better than my 30-year-olds who've had a baby, maybe because they're more focused and they're doing their exercises. So you definitely can improve things no matter what decade of life you're in, whether you're 70s or, and my younger ladies, I see most of those ladies have pain during intercourse. I wouldn't say the hormones affect things as much. Although, no, having said that, so I'm correcting myself. Your cycle, when you go through your period, right, you have dips in your hormone level. So for sure, if you have a pelvic floor dysfunction, usually before your period and before ovulation, the estrogen's a little bit lower, and you may actually find your symptoms are a little bit pronounced, which could be pain during intercourse, you're more sensitive, or leaking, urgency, anything that you have, you feel a little bit more heavy if you have a prolapse. Because my pelvic floor is not perfect, and definitely before my cycle, I definitely have more awareness of those symptoms. So it does fluctuate with your estrogen and your cycle too.
Yeah, that's really great information, Yolanda, because Nona Grace brings up a really good point, is that there is more focus on promoting undergarments that have the extra padding for leakage rather than the preventative side of it. And, the fact that you're seeing women well into their 80s, almost 90s, and having some success, it's really a testament that fitness and muscular strength and muscle development is going to support you well throughout your entire life, no matter which area of fitness we're talking about. So if we're talking about about your biceps for picking up your groceries, or we're talking about your pelvic floor for supporting your whole core and preventing incontinence in the later on years. It's just we need to really be aware of the discipline that it takes to have the proper nutrition, have the proper hydration, have the proper amount of sleep, but take care of those muscles. So whether through exercise or through nutrition or everything else. So we're just about coming into the home stretch here. It's been really, really amazing information. I feel like we could probably go on for quite a while longer. So I do hope that those of you who have tuned in a little later, Smitty's Fitness, it's a pleasure to see you here. If you have any quick questions, Yolanda's here for a little bit longer. We've been talking about the pelvic floor, and if you have missed the information, I really encourage you to go back to the replay and check out the whole host from anatomy to symptoms that occur when there's issues in this area, as well as some fixes of what you can do to take care of your pelvic floor and how that's going to help you to perform better, whether you're just exercising because you need to do it, or if you're actually performing as an athlete. It's going to be really important and serve you so well to have more awareness of your pelvic floor. So Yolanda, how would you summarize everything that we've talked about, and just kind of give people a little bit of a toolkit as to maybe identifying or the steps they need to take to identify, and some of the things they can do to get on the road to wellness when it comes to pelvic floor health?
I think generally, especially with a woman, and I know there's some lovely men out here too, but if you have anything going on in that area, just know that I would definitely get it looked at earlier than later. And preventative is such a big thing, like in terms of connecting. I mean, I saw some of the comments also in terms of, you use your pelvic floor when you're lifting groceries, use it when you're squatting to bend down. It's such a big part of the health of your back and your core and everything, right? So learning just being aware of how to contract the muscle and integrate it functionally is so important. And treating anything early, just like you would treat an ankle sprain before it becomes a chronic issue. Just get it looked at. It might not be much to treat, but just making sure it's optimal is really, really important. It's so much part of your holistic health. Like I said, bring it in with everything that you do, especially your posture, right? That awareness, breathing, it all affects your pelvic floor. It's a big part. And for men too, right? Men, I think, have been blessed with probably not as many issues, but they definitely have seen men with issues from their prostate, unfortunately, that fun little organ. That's the one that tends to piss them off after a while. And, if their hip muscles are tight again, it can push on the nerve in there. So definitely there can be a connection, even if it's up here. So just try to functionally integrate it. Be kind to it. It's a big thing for women, right? Like if you're having leaking and stuff, well, you might not want to be running a marathon. And I know it's important. I was there too. I know the mental health and how it's important and feeling like, you're back into it, but just be kind to it. Yeah.
That's awesome. Well, thank you so much. Before I let you go, Yolanda, I just want to thank everybody who's on here. We've got a few minutes late, so if you want to go ahead and plug your channel, if you've got anything coming up, go right ahead, pop that into the comments. And I want to thank everybody for participating, your questions, for watching and staying tuned in. It's been wonderful. And this is a busy month of May I can't imagine a better topic and guest to kick this off with. It's been a real pleasure. And next week we'll be hosting Tina Ferrone, who is a yoga studio owner. She has the bricks and mortar studio as well as the virtual studio. So it should be a real treat to get the ins and out of what goes on as a studio owner. But I invite you now on the to watch the replay as well as check out Yolanda's her channel, Yo and Vaginia, and there's Vaginia.
Yeah, there she is. Yeah. Really lonely. And if you have any questions too, please, you can. I actually have a website too, Yo and Vaginia. Feel free to pop me an email. Happy to help you out any way I can. If you have any questions, again, yeah, check out my website because there are some great videos, and you could try those first and see if they work. And generally, if you're doing Kegels and it's not helping, there's probably something else going on, which you need to see someone, whether it's me or someone else. Definitely.
Excellent. So excellent. So I think we'll wrap it up here. So yes, go check her out. Check out her info. You can follow her on Instagram as well. She's got regular posts going on over there, pretty active on all the platforms. So thank you very much, everyone. And you are so welcome for being here. And thank you, Yo, Vaginia. And we'll see you again real soon. Tomorrow morning, 11 a.m., I'll be doing a live yoga practice. So this week, it's all about the spine, taking care of the spine, flexibility of the spine, preventing injury of the spine. So join me tomorrow at 11 a.m. Eastern Standard Time. I'll be doing a live there. You can participate. I can customize to what your needs are. Oh, and there's Angela's wisdom and healing tips. Oh, a pleasure to have you on as well. Thank you for being here. And so everyone, I'll catch you on the replay, or I'll see you tomorrow morning for our live session, live yoga. See you soon. Take care, everyone.